So when you have a Remicade infusion, the first thing you need to do is find the medication. This is often where you store it when it comes in from the specialty pharmacy, whether it's in the top fridge or the bottom fridge. This patient, you're kind of protected when it comes from the specialty pharmacy because you know exactly how many vials they'll be getting for infusion. For this patient, we have 6 vials, which means that his dose of Remicade is 600 milligrams, since each vial of Remicade...
Wait, take his name
as I will show you...
away.
As I will show you, each vial of Remicade contains 100 milligrams of Remicade.
Wait. Okay.
And...
turn it around a little bit so you see the full name of the... Okay, good.
So each vial of Remicade is 100 milligrams.
Yeah.
So you know that when there's 6 boxes or 6 vials, you're infusing 600 milligrams.
1, 2, 3, 4, 5, 6. Okay.
So what I like to do is take all the vials out from their boxes. I like to put one box aside so I will remember to reorder the medication from the specialty pharmacy.
Box is going to the garbage.
Boxes are not sharp, so they go into the regular trash. Then I systematically pop off the tops. They're flip tops from the Remicade vials. I kind of keep them all in the same area of the counter. Then we have 6 vials still. I take the vials. They do have a kind of sharp piece of metal on the edge. So I do put them into the sharps container, like so.
Okay.
Closing the sharps container after I use it.
Because otherwise you can trip and fall and your hand lands all in the
Especially
sharps.
when it's full like this and about to be picked up. So Remicade is a lyophilized concentrated solution. You can see it kind of looks like a powder at the bottom. So it needs to be reconstituted. We reconstitute Remicade with sterile water. So over here you find...
Hold on, but let me just let it focus in. Your hand's in the way. So there is no liquid in there. There's just powder in that bottle.
Right.
Okay, very good.
So it needs to be reconstituted with sterile water.
Where's the sterile water? Okay,
Our
hold
sterile
on.
water
Okay.
comes in purple top bottles of either 50 mLs or 10 mLs.
Okay.
What I've done to make things easier for myself is that if the patient's getting 500 milligrams or larger of an infusion, I'll always take from a 50 and then supplement with the 10s. If they're getting 300 milligrams, for example, I'll just use 3 of the little guys as to not waste.
I see. So it's 10 cc per vial.
Right.
Okay.
Every vial, it's easy to remember, the final volume will be 10 cc, so 1 full 10 ml of the sterile water goes into each. So again, you pop off your tops, like so. So again, you have 6 vials of Remicade, you need to have 60 milliliters of sterile water. Then I come into my drawer down here, and you get a syringe.
Wow, the stash. Okay.
Again, since he's getting 600 milligrams of Remicade, I have 6 vials, and I know I need to dilute with 60 ml. I take a 30 ml syringe. This is a matter of personal preference. We also have 10 ml syringes. Using a 30 ml syringe just reduces the time you have to re-enter the sterile water into your Remicade vials. I come into this drawer.
Yes, the top drawer. Yeah,
the top drawer, and I get our largest needle, which is 16 gauge, which is a very large
hold on.
needle.
Okay, wait. Okay, very good. Go ahead.
You unpeel the needle like so.
Right.
And they fit onto each other with a simple twist.
Okay.
You take the plastic off.
Okay.
And you're going to plunge into the sterile water. You draw up your 30...
Okay, that's easy enough. So you draw up the water and you put 10 cc's in each bottle.
Exactly.
All right.
And Remicade specifies that you're not to... Obviously,
you're blocking me.
I'm putting 10 cc's in each bottle.
Okay.
And to the next. And Remicade specifies that you're not supposed to swirl it after you've added the water. You just kind of let it sit on the counter and it'll dissolve itself.
Okay, you're blocking me again. Okay.
So you finish the dilution.
Any other words of wisdom while you're finishing the dilution?
No.
What's the next step after this?
Your next step is going to be, at the end, you're going to be transferring your Remicade, obviously, into a bag of normal saline. So
the bottom line here is that if you're off by 0.5 milliliter, it doesn't matter because all these things are going to be mixed into one mother container, so to speak, or parent container that is going to ultimately be infused.
the next step is to get your bag of normal saline. We keep ours up in the bottom drawer. Take any bag.
How much?
250 ml bag of.
Wait 1 second. Let me just hook it up there. Okay, fine.
You rip open the bag.
Okay. That's not my bag, baby. Okay.
And a trick I found since working here is to hang it right here. This has a place to be hung right here.
Yeah.
You connect it like so.
That's a nice trick.
No, I
Okay.
thought of that myself.
That's good. You should patent that. Okay, go ahead.
With the same needle that just came out of what was diluting your Remicade.
Yes.
There are two areas on a bag of normal saline. One you see is a blue stopper, which you'll eventually pull to connect the tubing to, and the other is a place where you can put a needle in to withdraw or inject into the bag.
And you have to wipe that with alcohol first, right?
No,
Now that you didn't touch it,
I didn't touch it.
Okay.
But if you touched it, yes, you'd have to wipe it with alcohol.
Okay.
You're going to inject into it, and it should pass easily. You need to be a little careful where you hold it because you can poke through
And stab yourself.
in which case you need a new bag and a new needle. So since we have 60
And a Band-Aid.
mLs of Remicade, because each 100 milligram vial is the volume is 10, you need to withdraw from the bag of normal saline an equivalent amount of normal saline to how much Remicade you're going to inject.
Meaning you have to withdraw here 60 cc's of
Exactly.
normal saline.
Because
Okay.
I'm going to inject 60 cc's of Remicade, you're going to withdraw 60 cc's of normal
And-
saline.
Oh, I see what you're saying. You're removing the volume of normal saline. You're replacing it with the Remicade. So the Remicade that's here is going to end up going in this
So
bag. Okay,
the
fine.
final message is to always keep your final volume's always going to be 250.
Gotcha.
So if you're going to inject 60,
Okay.
you need to remove 60 first.
Fantastic.
That's
then.
why it makes it easier to use a 30 cc syringe.
Okay.
The best way to withdraw from a Remicade vial is to keep your needle at the very, very bottom of the vial.
So like right there's that little gray notch there. Keep it within that gray notch.
Exactly. And that'll let you get all of it out, because if you have
The
it
key,
hot,
and then if you have a couple little bubbles, doesn't matter.
doesn't matter.
Okay.
And since I'm using a 30 cc syringe, I can do 3 vials into one syringe. Again, it lets you withdraw everything. And then you go right back into where you withdrew from, and you'll see the bag.
Now that bag has just increased in value
By 30.
by however much the Remicade is
by
worth.
probably $1,500. And
Yeah.
so that's
What
a perfect
happened?
example of what not to do.
What happened?
It touched my finger. So what you're going
What
to do,
touched your finger?
the needle.
Okay.
So
Did you
what-
cut yourself?
No.
Okay.
Didn't cut myself, but what you need to do, obviously, is you need to change your needle. So the best way to do that is to recap it with your plastic.
Yeah.
All you have to do is turn, the needle comes
Okay.
off.
Good. Put it to the
The
sharps.
needle will go into sharps. And then you just start with a new needle.
Fair enough. Oh, this is a shoulder muscle workout here. I didn't realize that.
And also, you'll see after I withdraw from one, you want to push the plunger up to get the top of the liquid almost to the top of your syringe, so you'll have room to empty your other vials into the syringe. Again, I push up, and then do the last vial.
Okay. Let me just go close up. Oh, go ahead. Fine. You got it all out. And what are you doing to... Okay, there's the... Okay, good.
Okay, so it's full, so you go right back into the bag.
Wait 1 second. Okay.
So after your final vial is emptied into the bag, I no longer need this needle. There's no need to recap. The whole thing goes right into the sharps. And the container is closed.
Fine.
The next step is obviously to connect the tubing because this is going into a patient.
Do you have to label when do you label the bag?
I don't label the bag.
Okay.
Because I know my patients. If you want to, I'd say if you had...
We should label the bag. If you're doing more than one at a time.
Sure. So let's say I'm doing more than one at a time, and I know this is for a patient EC.
Okay.
And he's getting 600.
Great. That's like a good idea. Okay.
So the next step is to pick up the tubing. Again, I took the tubing from this drawer.
Okay. Is there any special characteristics of this?
Again with spike, I will show you. The first thing you want to do is remove the paper so that tubing becomes free. And there's two ends to the tubing. There is the spike end, which is covered, which will eventually go into your bag.
Okay.
And then there is the other end, which will go into the patient's IV port.
Okay.
You'll see that on the spike end, there is a little blue tab.
Okay.
The blue tab, when you're spiking a plastic bag of any kind of solution, be it Remicade, Rituxan, anything you've diluted into normal saline, should always be closed.
Okay.
Like it comes.
Okay. The
only time you will open that, like so, is when you're spiking a glass container, which is usually in our practice when you're doing an IVIG infusion.
Okay.
So, you'll also see that this tubing has two locks to it, two ways to lock it. You can either roll this down, or what I do is take this blue tab, and after the line has primed, meaning I've let the solution run through to the end, you lock it like so.
Priming meaning getting all the air out of the line so that you don't infuse air into the patient and give them an air embolus.
So you lock it like so, and this blue tab is actually what's going to sit in our infusion machine and let our machine work.
Okay.
So again, you unlock the tab. So this just takes a little bit of pre-thought. So I will remove this. Again, you're not going to touch it because it's going to go into your bag.
Okay.
You're going to pull this out. Your Bluetooth tab comes right out.
That blue tab came out from
this
there.
Little port.
Okay, fine.
Pull it right out. It's plastic. You can trash it.
It's like you're milking a cow. Okay.
Really? And you kind of have to hold it stiff, this part of the bag.
Yeah.
And you push it all the way up and kind of work it up. As soon as you break that seal, you're going to see fluid starts to run out.
Yep.
You're going to wait until the fluid runs out to the end. You can kind of track it.
I don't know if I'm tracking it here,
but it's hard to see because it is a clear fluid.
Yeah,
you see it's dripping now.
Like you're moving. Oh, there we go.
So I will now lock it.
What are you locking? Where?
At the blue tab.
Okay.
I've locked it. So fluid is no longer dripping out of the end.
Okay.
There's no air bubbles left in the line.
Okay, and you've let it drip into the garbage can. I mean, you didn't let it touch the garbage can, but so that you don't make a mess on the floor. Okay, because this is right over the garbage can.
And
okay.
This is also, it has a cap on it, so if it's best not to let it touch the floor, but the part that is actually going to screw into the IV is protected.
Okay.
Now we're ready to infuse.
Okay, well, ready to infuse. So how do you do that?
So I'm going to walk my bag over to a.
So just get without showing the patient. Do I have yeah, get that pole there. Good.
So we have 3 infusion machines in this center. And can you see me?
Yeah.
Yeah?
I should maybe get a little. Well, it's okay. This is fine.
So you're going to hang it on one of the
poles. Okay.
The same blue tab that you've just locked to stop the flow of solution.
Yes.
Now has an end that's pointy, and it fits directly right into this hole below the word safety clamp. There's only one area to put it.
Okay.
Before you put it in, you want to make sure that the part you're sticking in the top of the bag is above it, and the bottom of the bag that's going to flow down to the patient is below it, because it's easy to reverse it, and then blood will flow from the patient to the machine.
So hold on. So
So you just want to get your orientation.
I see what you're saying. So whatever the natural orientation is, you shouldn't.
You want to go like this. You want to make sure up is up and down is down. Because
Gotcha.
if I went like this,
Right.
which is just a simple turn, blood will flow from the patient to the bag.
Okay, fine.
So you want to just press the tab into the machine. It kind of clicks. And with your other finger, you're going to thread the tubing up into the track. It has a little turn at the top, so it lies flat.
Yes, yes.
You're going to close the door. This bar is going to be straight up, kind of perpendicular. You're going to hear a click. You're going to press down, and now you're all set.
And okay, so now and so the only other thing is now you have to connect the tubing to the IV. That's pretty straightforward.
Yes, all
And
you do is take off the blue top, and it twists right in, twist, until it tightens, and then you're all set.
okay, and then what buttons do you press?
So then you're going to press on, off, charge, it's yellow,
Uh-huh.
bottom right, once. Since again, our final volume is 250,
Uh-huh.
I like to set it to give myself a little bit of air, 255. So you press PRIVTEI,
Okay.
255.
Uh-huh.
And your starting rate, whatever
Uh-huh.
your starting rate is, in this case it's going to be 20, that's 20 milliliters per hour, which is going to be our starting rate for the first 15 minutes of the infusion. Of course, I'm not going to push start or it would start.
Right.
But when you are ready to start, you press PRI start. So basically, you're never pressing the numbers on the bottom, at least for our purposes here. You're dealing with these three buttons
Yeah.
and the on-off.
And then when you have to increase the rate per protocol, what do? You press stop?
You press rate.
Uh-huh.
The next increment will be 40. You press rate, 40, start.
So it just while it's flowing, you press rate 40 start, and it switches up the rate.
And you'll see that if the machine's stopped and I've already entered my information, it gets angry, so it'll give you a nice beep. It'll say stop to remind you that it's stopped. And the way you can silence that is just push silence, which is a white button, second to the top.
Great. I think that's it, right? Thank you very much.